Hi, my name is Micah, and today my peers Alli, Audrey, and I will be discussing the role of caregivers in the lives of patients with Duchenne muscular dystrophy. So, caregivers have a background made up of a wide range of healthcare professions. For example, they can be registered nurses, nurse practitioners, licensed vocational nurses, and even family members. They act as the first point of contact for DMD patients, since local emergency departments are often unequipped to handle DMD medical scenarios due to the rarity of the disease. People called care coordinators, such as social workers, help out with transition planning when patients are first assigned a caregiver. This can help ensure that the individual needs are met and also can help families avoid fragmented care. So, families have the option of hiring a professional caregiver who has completed various ethical and medical training courses and often has certifications through organizations like the NIH or Caregiver Action Network. However, since DMD patients are generally children and live at home, they are often cared for by informal family caregivers. Since this is technically free, the situation is often observed in families under economic stress, which is often the case since the high cost of DMD treatment options can put financial strain on families. It truly depends on each case, since a formal and informal caregiver each offer different benefits. In either scenario, there's an unfortunate dichotomy that results as patients grow older and they have a desire for more independence, but also an increasing reliance on a caregiver to complete daily activities. The right support from a caregiver, either informal or formal, can help diminish challenges DMD patients experience when transitioning to adult lifestyles.
Hi, my name is Alli Hinmon, and I want to talk to you guys about the healthcare professionals' physical and mental role when caring for DMD patients. So, DMD patients many times need assistance while bathing, using the restroom, or many times something as simple as getting out of bed or making lunch. Along with ensuring the safety of patients at all times, caregivers also may be responsible for emotional and social support. As you can imagine, the patient may face mental health issues because he or she is unable to walk, play, or function physically as well as he or she once had. All the while, their ability to think cognitively has not been damaged. So that can be really hard to cope with for both the patient and the caregiver. Therefore, the caregiver's role in the mental and social side can be just as important for caring for the patient's physical health as caring for the patient's physical health. This stretches the reach for caregivers to also have the psychological role in the patient's lives. So, DMD is generally diagnosed around the age of 4 years old to males. As the disease progresses, the patient might move from getting support from the parents and family members to getting support from a caregiver or both. Um, Physical stretching is one of the most important therapies of DMD. Um, and this often can be performed by the DMD patient with the help of the caregiver. It can help maintain or increase flexibility, make movements easier, increase safety when standing and walking, or even deter any invasive surgeries that are sometimes performed in the case of DMD. But most importantly, it makes sitting and laying down significantly more comfortable for the patient. So now I'm going to demonstrate a few of the physical therapy activities used to maintain the flexibility, mobility, and strength of the DMD patients. So first, as you can see, the hamstring stretch is holding one leg up so that the leg and the body are at 90 degrees. And then hold the knee and slowly straighten the leg until you feel the tension. Do this for about 60 seconds. Next, you're going to go over to the heel, the Achilles and the gastric stretch. So the leg is down and the knee is loose, as you can see. Don't hyperextend the leg. Slowly pull downward on the Achilles with your hand and use your inner elbow to bring the toes towards the patient's nose. Finally, forearm supination and pronation. First, you want to bend the elbow at 90 degrees. You want to keep the elbow against the body. Then turn the palm towards the nose and face, and slightly you're going to extend the palm to extension facing upwards. Then you're going to turn the palm the other way and you're going to bring the palm down to the body slowly with the fingertips towards the nose. Do this for about 60 seconds, and there you go.
Hi, my name is Audrey, and I'm now going to be talking about the many obstacles that caregivers face when dealing with DMD patients. Being a caregiver of a patient with DMD is not easy, and since the caregivers are often unpaid family members, there are a variety of obstacles they face. Taking care of a patient with DMD can have significant effects on the caregivers, leading to lower health related quality of life, poor sleep quality, depression, pain, stress, and lower self esteem. All of these factors have negative consequences on work life and productivity. Not only is there undue stress on the caregiver, but oftentimes, despite the best efforts of the caregiver, DMD patients receive suboptimal care from the family member. This is because the family member is not an official trained caregiver or medical or healthcare professional, but the family and patient have no other choice because they are unable to afford to hire a caregiver. Serving the role as the caregiver becomes a full-time job for the family member. In fact, the mean percentage of the caregivers who stopped working completely to care for a DMD patient was 29% in Germany, 33% in Italy, 21% in Australia, and 50 or more percent in the UK. Caregiving becomes the main responsibility, inhibiting the family member's ability to do other work. Caregivers are responsible for many daily activities, leading to burnout syndrome. In addition to this, since the caregivers are often family members, specifically parents, since DMD patients tend to be children, they often comprise feelings of guilt. Parents feel responsible for passing down the disease to their child with DMD, as it is a genetic disease. The whole family is often affected. Siblings are oftentimes deeply involved with the informal care, but in surveys asking individuals with siblings with DMD, they describe it as normal and all they have ever known. Although it may seem siblings could be negatively impacted, it is actually found that siblings identified increased family cohesion, knowledge, and maturity as a positive impact of the caregiving. Overall, we can see that serving the role as a caregiver for a DMD patient is often fulfilled by a family member, and that these responsibilities are essential for the DMD or for the individual with DMD, but also greatly influence the life of the caregiver. Caregivers can come from a variety of backgrounds, sometimes with a healthcare background, sometimes without, but they help ensure the quality of care meets the individual's needs. Here are the references used for this presentation, and overall, we have found that ultimately the lengths that family members and caregivers will go through to ensure the mental and physical well-being of the patient are incredibly heroic.